This segment of Delmarva Life is brought to you by Peninsula Home Care.
So, how's your spring cleaning going? Have you even started? If you have, you've probably been giving a good deep scrubbing to some of the out of reach places like, under the bed, behind the dresser, maybe the shelves in your pantry.
Now, here's a place that maybe you haven't thought of yet. How about your medicine cabinet? Here this afternoon to explain why giving your medicine cabinet a good spring cleaning is Peninsula Home Care at Nanticoke Hospital Liaison. This is Tisha Donovan. Thank you so much for joining us today.
Thank you.
Okay, so in reality,
Yes.
we're not talking about spick and span scrubbing the inside of the medicine cabinet. We're talking about medicine management.
Correct.
Explain that.
Well, first of all, we call it a medicine cabinet, but really medicine shouldn't be kept in the cabinet, in the bathroom, because of the humidity.
Oh.
So ideally, it should be kept in a dark cabinet, probably in the kitchen away from the stove, because light will also cause problems. So heat and light are what cause the breakdown of the medicine.
Okay.
So if you are keeping it in your cabinet, which many people do, and I used to also many years ago, you want to look for medicines that are crumbling, breaking, even swelling, because the moisture from the bathroom can cause them to swell, and change in smell. So if you see any of those, obviously throw them away immediately. But also, you don't want to keep medications in your refrigerator unless they're supposed to be refrigerated. It does the same thing. Often people will think, oh, well, it's just going to keep it longer. It doesn't. And if you have medications like eye drops or liquid antibiotics that are supposed to be in the refrigerator, don't keep them for longer than they should be.
Gotcha. Okay, so wherever you keep your medicine, you do need to go in there periodically and look for these things?
And look for those things.
Why is that important?
Well, if you keep your prescriptions longer than the expiration date, which is fine, maybe not 10 years after the expiration date, but to a point, you want to make sure that they are not breaking down. But you also, if they are too old, they can lose the effectiveness of the medication.
Gotcha.
Okay, so you help people when they get home after being discharged from the hospital.
That's correct.
What kind of medicine challenges do you see with people that are going home?
Well, first of all, when they've been in the hospital, they have so many new medications or changes in medications, they're already not feeling well and they're overwhelmed.
Right.
So we will see that there's some confusion about that. Also, just simply maybe not having the means to go pick the prescriptions up that have also been called in. Those are a couple of different problems. So we will work with them, our nurses in our office will work with them to make sure that they have the right medicines, that they have been picked up. When the first day we go in, we will say, let me see all of your medicines here, because they might have 3 bottles of the same medicine and be taking it, or maybe one's a name brand and one's a generic, and then that can cause confusion. Yes.
Okay, and so in addition to not taking their medication and the things you talked about, what are other ways that people, I guess, are non-compliant when it comes to their medication that might send them back into the hospital?
Well, non-compliant in the sense of not taking something, even taking them too often, because they think, well, maybe I'm a little swollen today, I'll double up some, but then your prescription runs out in 2 or 3 weeks and you have a whole week that you don't have any medicine at all. That can be a problem. They also need to just look, just starting right from the pharmacy, make sure when you get your prescription bottle that it has your name on it and the correct prescription. It does happen. We're all humans, and the people filling the medications, things can happen. Or that if you get the prescription and it looks different than it ever has before, ask the pharmacist if it is still the same prescription.
Are we getting help from the doctors and the hospitals in trying to keep track of this?
Absolutely. The hospitals have case management. The case managers work so hard in the background with the discharge planning so that they can make sure when it comes to the medicines that sometimes even the pharmacies are delivering the meds to the patient at the hospital before they leave, if they know that's going to be a problem. Or if they need just extra help with insurance problems, if they need oxygen delivered at home, the discharge planners take care of all of that. And I work very closely with them every day.
Very good information. Tish Donovan with Peninsula Home Care at Nanticoke Hospital Liaison.
Thank you.